America's opioid crisis shows no signs of abating.
Tonight, a grim statistic. One American is dying from a drug overdose every 5 minutes.
Where the opioid epidemic has now evolved into a fentanyl nightmare.
There are millions of these dangerous fake pills out there, and they are killing thousands of Americans.
We have a vision that our society will look this disease straight in the eye, prevent it and treat it with love and empathy, and with protocols based on science.
We are coming together to increase awareness and funding for the prevention, treatment, and recovery of this disease.
We are here for friends. We are here for family. We are here for community. And we are here to bring the disease of addiction out of the darkness and into the light.
We are Shatterproof!
My older son, Brian, struggled with addiction for 8 years. And during that time, he went to 8 different treatment programs.
Shatterproof is currently developing public databases in multiple states that, if successful, will allow the public to identify, evaluate, and compare substance use treatment programs.
I would like to extend my appreciation to President Bill Clinton, Chelsea Clinton, and their Health Matters initiative.
I'm very grateful to be here today at a critical time to talk about why we must tackle this issue and what Congress must do to tackle this issue.
We need to start treating people in this country, not jailing them. We need to give them the tools they need to recover, because every life is precious. Every life is an individual gift from God. And we have to stop judging and start giving them the tools they need to get better.
I don't think about this issue as a public official or as a healthcare guy. I think about it as a father. I've talked to people who've been in the middle of this, and they're among the grittiest and gutsiest people I've ever met. And they deserve our respect and our love and our support.
Let's create that world that Brian didn't see. Let's create that world for the next young man that comes along, the next young woman that comes along, the next family. Let's drag addiction out of the shadows and into our hearts. I can't imagine a more perfect expression of humanity. Thank you.
Good morning, everyone. Thank you so much for joining us today. My name is Kristen Pendergrass. I am Shatterproof's Vice President for State Policy. For those who don't know, Shatterproof is a national nonprofit dedicated to ending the addiction crisis across the country. We were founded about 10 years ago by Mendell, who you're going to hear more from later, and I will let him tell the story of founding this incredible organization. We have 3 pillars of work. The first is educating and empowering communities. The second is ending the stigma of addiction. And the third, which you're going to hear a lot more about today, is ensuring access to quality substance use disorder treatment. Today, more than 46 million Americans ages 12 and older currently live with a substance use disorder. In Connecticut, in 2021, which is the most recent year that we have data, there were 1,427 deaths related to opioids. That's 1,427 of our friends, neighbors, and family members. This morning, we're going to hear more about an incredible new resource that's available throughout the state to help prevent future losses and help people find addiction treatment. We're honored to have a number of very impressive speakers with us here today, including the Lieutenant Governor, the State of Connecticut Department of Mental Health and Addiction Services Deputy Commissioner, 2 state senators, a representative from U.S. Senator Blumenthal's office, someone from the Department of Children and Families. I will introduce them all as they come up. As I mentioned, our CEO and founder, and a member of the community here who has been a tireless advocate for people with substance use disorder. After our speakers, we'll take questions, and then we're going to have a tutorial from our Shatterproof lead in Connecticut. So I'm first going to introduce Lieutenant Governor Susan Bysiewicz. Lieutenant Governor is serving her second term and is the 109th Lieutenant Governor in Connecticut. I'm not going to read everyone's full bios, but she previously served as a Secretary of State and a state representative and has been a champion for people of Connecticut struggling with substance use disorder. Lieutenant Governor.
Good morning, everyone, and thank you for joining us for this very important press announcement. You've heard that in our country, substance abuse disorder is a huge public health crisis. More than 12%, more than 40 million people in our country are suffering from substance abuse disorder. And in Connecticut, as you've heard, last year we had 1,427 of our friends and neighbors and family members who lost their lives to substance abuse. And also here we know that unintentional injury, which is either overdoses or motor vehicle accidents, are the leading cause of death for people that are 44 and under. So this is a public health crisis in Connecticut and across the country. So that's the bad news. But here is the good news. We want to tell the people who are living with substance abuse disorder, who may be feeling alone, they may be feeling forgotten, they may be feeling helpless, that you're not alone. We haven't forgotten you, and help is available. There is hope. And we want people to know that this is a problem that affects all races, all age groups, all economic backgrounds, all genders. And we are here to announce a first of its kind, life-saving online platform called Shatterproof Treatment Atlas. It's free, it's confidential, and it will give information to support those in need and to their loved ones who are looking for appropriate quality care. And we know that addiction is a very complex and tough battle. Our state wouldn't be able to fight it without the powerful advocacy of groups like Shatterproof. And I am here because my friend Dita Bhargava has taken personal tragedy and transformed it into advocacy. And so has the founder of Shatterproof. And to me, this is the most inspirational part, that people who have gone through an unimaginable, difficult, and tragic time have taken positive action to help others so that they don't have to go through what they went through. So I want to take this opportunity to encourage anyone in Connecticut who needs support or treatment, whether for themselves or for someone else, to reach out, because our state has a lot of resources. The problem is people just don't know that they exist. And that's why our Department of Mental Health and Addiction Services agency is here to tell you more about the programs that we have. We have a Live Loud campaign that connects people with treatment and resources so that they can begin their recovery. To get connected, visit our www.liveloud.org, or give Demas a call. There is a hotline where someone will answer 24 hours a day. People in need can also visit the Demas Addiction Services availability site to see what treatment options are available in the state. I know that everyone here and so many people across the state have been impacted by addiction, and so it's up to all of us also to talk to our kids early and often about the dangers of alcohol and drugs. It's up to all of us to safely store medications and dispose of unused medications safely. And it's also up to us to keep Narcan with us. I know I have Narcan in my car, so in case I come across someone who needs it, I have it. And please spread the word about the danger of fentanyl and other street drugs. And most impactfully, thank you all for coming to help us stop the stigma. And again, I want to encourage anyone out there who's struggling and suffering to reach out for help. Too often people don't reach out for help because they're afraid of what their family and their friends are going to think. So please, please, please reach out, take advantage of this new Atlas program and all the resources that are available to you in our state. And again, thank you to Shatterproof and to my dear friend Dita Bhargava for being such an amazing advocate for this important issue.
Thank you, Lieutenant Governor. I know you have to run, but we really appreciate your coming. We are now going to hear from the Deputy Commissioner of the Department of Mental Health and Addiction Services. The Department of Mental Health and Addiction Services serves over 100,000 residents every year and has been a national leader in ensuring that people with substance use disorder have access to substance use disorder treatment. They've also been an incredible partner to us as we get treatment atlases launched in the state. So we're going to hear from Colleen Harrington, the Deputy Commissioner. Thank you.
Good morning, and thank you for the opportunity to be here and represent Demas in this environment. As you've heard already, in Connecticut and across the nation, we're still in the midst of an opioid overdose crisis. Last year alone, 1,427 Connecticut residents succumbed to overdose. Although that number represents a 4% decrease in the previous year's total, we all know that one life lost is one too many. Some families who have lost a loved one to overdose channeled their grief into creating a personalized memorial squares that were quilted together into a beautiful remembrance quilt, which is prominently displayed at the Department of Mental Health and Addiction Services offices. The names, faces, and messages of love stay with us every day as we do this work, reminding us that this complex health issue affects all of us, and a response requires empathy, compassion, and understanding. Every individual struggling with substance use disorder is someone's child, someone's sibling, someone's friend, and all deserve our unwavering support. We need every resource available to continue to fight this crisis, and today we add Shatterproof Treatment Atlas to our array of tools. You will hear more about the platform, so I won't go into that, but I will say it is only by working together that we can break down the barriers that prevent individuals from seeking help and accessing the care they need. Demas is proud to join with Shatterproof and other community partners in providing pathways to the highest quality and most appropriate treatment options for each individual's need. Let us continue to strive to create a world where no one feels alone in their journey, but instead feels the support that recovery is possible and within reach. Thank you.
Thank you, Deputy Commissioner Harrington. DMAS really has been a wonderful partner as we get this up and running and available to residents of Connecticut. We are now going to hear from State Senator Anwar, who represents Connecticut's 3rd District, overseeing the towns of East Hartford, East Windsor, Ellington, and South Windsor. In addition to being a state senator, he is also a medical doctor and serves as the chair of the Department of Internal Medicine at Manchester Memorial and Rockville General Hospitals. Senator.
Good morning, everyone. I'm honored to be here this morning. This is one of the most important issues that we are dealing with. I'm currently also serving as the co-chair of Public Health Committee. For our committee, this issue has been critical. Even before the pandemic, this was the epidemic that we were dealing with. Despite working on multiple policies, we have really not made a huge difference in saving lives. By the end of the day today, 4 more people full of dreams, full of hopes, full of family, friends, and people who care and love them will be lost. Every single day, we are losing 4 people in the state of Connecticut. And despite working on various policies, we have not been able to make as big a difference as we need to. And that's why we have to be at every meeting, every gathering, every place where there is opportunity of addressing this. As an intensive care unit doctor, I have seen far more than my share of individuals who have passed. And I have spent hours holding hands of the loved ones, family members, and they ask questions of why and how. And it's important for us to look at this as a public health area of opportunity. I didn't want to use the word failure. We are never going to fail. Drugs are strong, but we are stronger as a society because we come from a place of love. And Shatterproof is coming from a place of love. And Demas is coming from a place of love. We will be able to address this. We will be able to make sure that we do collectively far more. The way to approach this is to meet people where they are, accept them who they are, and love them unconditionally. Once we get to that point, then things are going to be a marathon where we work together as cheerleaders, as community members, as friends, to be in this place to make sure that each and every person gets the opportunity for rehabilitation. And I have been fortunate to interact with so many people who have recovered. And that gives me so much hope. And I have found some of the kindest, nicest, most caring individuals who have been impacted by substance use issues. And when they are better, they are a blessing to everyone. And Shatterproof, you have done a number of good things. One of the amazing things that you've done is you found a super ambassador in Dita Bhagrava. She's a person who has taken on this issue, and she has been, I'll share this as a public health committee chair. The conversations that we are having now in policy, Dita has been talking about that many, many, many years ago. And we are now coming to the realization, yeah, Dita said that. Yes, Dita said that too. And Dita, you said it. And we are working on these policies. The federal government is way behind in addressing those, and we have to fight those battles on the harm reduction opportunities. So at the state of Connecticut, we are ready. The state and the country is not there yet, and we will have more work to do. Every time we come together, this is an opportunity to organize and address more policies. In the state of Connecticut, our doors are open because our hearts are open. We have all been touched, and we will be working to make sure that even the federal policies follow up on some of the aspects, especially the harm reduction centers and safe consumption issues. Thank you again. Thank you for being here, and thank you for allowing me to speak.
Yeah. Maybe it's extra. Thank you, Senator. We're also going to hear today from State Senator Rahman. He represents Connecticut's 4th Senate District, including Andover, Bolton, Glastonbury, and Manchester. He is the CEO of several businesses and has been recognized for his charitable and philanthropic work. Senator?
I'm not tall enough, I'm sorry. Good morning. It's great to be here. Thank you. Thank you for being here. I have visited a number of recovery facilities across the state of Connecticut. one facility in Manchester called Pathfinder. I visit twice a year. I have made connection with a number of individuals there. Whenever I sit and talk with them, I always amaze how talented and bright those people. But early on, they made mistake that nearly impossible to recover from alone. They need help. They have planned to recover and get back to their life, but they can't execute their plan without our help. They need to know where they can go, how they can get quality care to recover and get back to their life. We have a good news, great news today, Connecticut. Shatterproof Treatment Atlas show us end of the tunnel, we see light. We are in this together. If we work together as a team, we can do anything, everything. We can help them get back to their life. I want to thank to my good friend, Dida, since she lost her son tirelessly, not just in Connecticut, nationwide, she's working hard every day, supporting individuals who need desperate help. Thank you. We want to support Dida, and Dida can support folks desperate need help. This is why I'm in here. I have scheduled to visit 20 different non-profit organizations. Next 3 weeks, we are going. And one of the organizations also, recovery facility, I am going next week. Reason I'm involving closely, someone have to step in and help those individual desperate need help. I want to thank to the Shatterproof Treatment Atlas. Thank you. Thank you for your dedication and hard work and putting this together. Now people can go find the place, they can find the help, their desperate need, and then receiving the quality care from there. Let's continue to spread the word and make easy access for every single individual who need help. Easy access, very important. I was helping last year someone, he couldn't find the quality care in Connecticut, went out of state. But we have place in here. They don't know how and where. So this is important. Community awareness about this organization exists. Can direct them where they can go, how they can receive quality care. I want to thank to the state of Connecticut partnering with these amazing organizations. Thank you. Once again, thank you for being here and supporting all the individuals desperate need help. Thank you.
Thank you, Senator. We're now going to hear from the federal level. We are lucky to have Richard Kehoe, the state director from U.S. Senator Blumenthal's office. Senator Blumenthal has been a champion at the federal level to ensure access to and affordability of naloxone and increasing access to medications for opioid use disorder.
Thank you very much. Senator Blumenthal regrets being unable to be here today, but the Senate is in session. And so therefore needs to be in Washington, but he is a very strong and longtime supporter of Shatterproof, working with Keri, working with Dita on the opioid issue. And when you hear about 1,400 opioid-related deaths a year in the state of Connecticut, effectively that means that there isn't a single family that doesn't have some impact as a result of the opioid epidemic. And so Senator Blumenthal has been working with a whole host of organizations across the state of Connecticut. He has been to addiction service providers throughout the state of Connecticut, whether it's the Quiet Corner, we'll call it Quiet Corner, of Northeast Connecticut to Greenwich, to New London, up to Harrington. And what he takes away from all of those conversations is that this is an epidemic that is multi-headed. There's different reasons why people succumb to opioid addiction. And as a result, the solution is multifaceted. And so he has been working at the federal level for more resources, because we do need, we recognize that we need more residential care. We need more beds for people who have sought out treatment. And unfortunately, in a number of instances, there just simply isn't the beds for them. And also the need for additional mental health providers of various forms across the medical profession. And that requires job training, and that requires federal resources. And then finally, he has been fighting for better insurance coverage for mental health treatment. We have had mental health parity laws on the books, both at the federal level and the state level. And we know that that has not reached the goal that we hope to accomplish. And that is something that continues to fight to this day. The Biden administration has just recently come out with regulations to toughen oversight over insurance provider coverage here. So that's a number of things that he's fighting for at the federal level. At the end of the day, it is a partnership. I think MD mentioned this, between the federal government, what is really going on here, which is very groundbreaking under the Lamont administration at the state level and at the local level, both from the local health districts as well as the organizations like Shatterproof and others that are on the ground and working to not only change policy, but to provide better services for those in need. So thank you for inviting Senator Blumenthal here. Thank you for having me speak. And you can guarantee that if Senator Blumenthal is in the state of Connecticut, the next time Shatterproof is having an event, he will be there. So thank you very much.
Thank you, Richard. I know we all appreciate Senator Blumenthal's efforts. We're next going to hear from Keri Lloyd, the Behavioral Health Program Manager at the Connecticut Department of Children and Families. The Department of Children and Families is an essential partner in preventing substance use disorder in Connecticut and ensuring that families have the support they need to navigate substance use disorder and recovery. Keri.
Good morning, everyone. The Department of Children and Families is honored to be a part of this day alongside the Department of Mental Health and Addiction Services, Shatterproof, and all of you to support and commemorate the launch of Treatment Atlas. I know Commissioner Durantes would be here if she was able, since this work is so important to our mission of supporting children and families. Our agency's mission of partnering with communities and empowering families to raise resilient children who thrive includes supporting a recovery-oriented system of care that is designed to prevent the negative impact of substance use, promote wellness and resiliency for our children, families, and the community at large, support children and caregivers who need services to recover from substance use concerns, and sustain recovery for children, adults, and families by providing recovery supports, recognition that recovery is possible, and the elimination of stigma in our communities. Our department values Treatment Atlas's approach to helping Connecticut's families receive free, reliable, and easy to navigate information about treatment options and the ability to connect to services quickly. Treatment Atlas's use of the Shatterproof National Principles of Care aligns strongly with Connecticut's efforts to ensure that individuals are receiving timely access to critical levels of care at the time that they need that treatment, that they have access to medications for substance use disorders, that the programs that are serving them are using evidence-based practices, and that people who enter treatment receive individualized and whole person care focused on the individual's strengths, needs, abilities, preferences, and desired recovery goals. We look forward to the ongoing collaboration with DEMIS, Shatterproof, community members, and other stakeholders to positively support the families of Connecticut affected by substance use and help make recovery in all its forms possible. Thank you so much for having us here today.
Thank you, Keri. Our next speaker is not only the founder and CEO of Shatterproof, but he is also a Connecticut resident. I am going to let Gary tell you his story and get your tissues ready. Gary?
Good morning, everyone, and welcome. And I just can't thank you all enough for being here and calling attention to this important issue. I'd like to start by acknowledging Lieutenant Governor Bysiewicz for being here and being her leadership in this. We met several years ago and started talking about Atlas at a get-together in Greenwich, and it's just wonderful to see this come to life with her leadership. Certainly want to also acknowledge DEMIS Commissioner Nancy Navarrete, Deputy Commissioner, I just know you by Colleen Harrington, excuse me. State senators, family of children, services for being here, and of course, Dita, for your leadership and help in everything we're doing in Connecticut. Can't thank you all enough. Helping Shatterproof to help the residents of Connecticut depends on the strength of our partnerships, like the ones I just mentioned. We've had a wonderful support from so many partners here in Connecticut, many of whom I just mentioned. And as a Connecticut resident, raised my family here, I just can't thank you all enough. Thank you. I would also like to thank Connecticut's treatment programs, treatment providers, who have recognized the importance of Shatterproof Treatment Atlas.org and provided so much help to us. Over 300 providers in the state have provided data for us, and over 300 of the 450 treatment programs of the state have offered advice to us of how to improve Atlas and make it more efficient and better help the residents of Connecticut. So for the treatment programs in the state, I can't thank you enough. And while Shatterproof is the convener, we're only one by ourselves. It's everyone I just mentioned and all the community-based organizations, who you've just heard from a few, that are joining with us to get this done and help the people of Connecticut. As a little bit of background on Shatterproof, my career was not in business or was not in healthcare or nonprofit. I was in the business world, raising my family here in Easton, Connecticut, not too far from here. And my older son, Brian, in high school became addicted to alcohol and drugs. As a family, unlike someone who was being treated for cancer or any other disease, we were lost. What type of treatment did he need? Did he need outpatient or residential? We had no idea. Did he need medications? We had no idea. Mental health services, no idea. Could we find a treatment program that was following science-based practices? No clue. We were lost. But we tried our hardest as a family, and so did my son, Brian. Over 8 years, he went to 8 different treatment programs, trying his hardest. And he was starting to do better. I remember celebrating with him 1 year of substance-free. But then 5 weeks later, I was woken up in the middle of the night on October 20th, 2011, just over 12 years ago, and told that my son had just died. Again, 25 years old, hadn't used a substance in 13 months. But equally tragic, and every speaker here today has mentioned it, it wasn't just addiction that took my son's life. It was the shame of every morning waking up and feeling ashamed of himself all day long, feeling stigmatized, that caused him to wake up that morning, research suicide notes, write a note of his own, and take his own life. Alone. In the weeks that followed, I began to focus on 2 questions. What could I have done differently as a father? How had I failed my son? But having to accept whatever that was, how could this tragedy be used to spare other families of this tragedy? So I took what I thought would be 3 months away from my business and traveled the country, meeting with experts. I learned a lot, but one thing rose to the top of the list that destroyed me all over again. I learned about research, wonderful research, that was in medical journals, that had proven without any doubt, if implemented, would significantly reduce the number of our loved ones who would ever develop this disease. And second body of research that had proven, again, without any doubt, through randomly controlled trials, if our treatment programs followed certain protocols, all based on science, those with this disease would recover at success rates on par with someone being treated for any other chronic medical condition, like heart disease, like diabetes. But I wrote the word tragic on a piece of paper. And I didn't write tragic because my son had died. I wrote tragic because he didn't have to die. Because all this information, if implemented, instead of being buried in medical journals, could have saved his life, either through prevention or treatment, and literally millions of others. Millions of families not having to lose a loved one. When all we had to do was lift this information out of the journals and get it implemented, block and tackle. So from this, a vision emerged of creating one well-funded national nonprofit for this disease like there are for others. American Cancer, American Heart, Susan Komen, go down the list. With one dedicated mission: lift the information out of the journals, transform our treatment system, end the shame and the stigma, and educate our families on the prevention and treatment and recovery of this disease, information that I didn't have as a father, but existed, and we just needed to get it out. Our first order of business was transforming the treatment system in the United States. And from that, you're hearing about it today. Treatment Atlas, as you've heard, is the only resource of its kind in the United States. If you're looking for treatment for you or a loved one, you can go to Atlas, take 10 simple questions that takes a few minutes, all confidential, and get a recommendation from the American Society of Addiction Medicine on the Atlas website of what level of care do you need. Do you need outpatient or residential? What services do you need? Do you need mental health services? Do you need medications? And once you answer those questions, you'll get a list of the treatment programs in your state that fit that criteria, and you can easily find one that is following evidence-based practices versus the ones that aren't. And then you can also filter by, do I want adolescent or adult? Do I want LGBTQ? Do I want to be able to use my cell phone or not. You could filter by the things that are important to you, and it titrates the treatment programs to your criteria. This doesn't exist anywhere in the country, and now it exists in Connecticut. It's going to help so many people. But as I always say, it's just one. Save one life, save the world. In closing, a few other things about Atlas. Number one, we launched Atlas for the first time in 6 states 3 years ago. Since then, the states have loved it. They're continuing to fund it. We added 4 more states last year, got to 10 states. Added 4 more states this year. We're in 14 states, including Connecticut. And those are large states. 14 states, although it's 28% of the number of states in this country, it's 45% of the United States population. We're almost half, and by next year we'll be at 60%, living in states representing 60% of the population or more. Because we're talking to 7 other states right now, and I'm sure we're going to get most of them to engage with Atlas, just like Connecticut has. Over 300 treatment programs provided data for us. Thank you, treatment programs, for your participation that are now on Atlas. And now in a final closing, I want to give a few words beyond Atlas to what every speaker has talked about today. I often think about the last time my son came home for a visit, 4 months before he died. That last night, we're sitting on the back porch talking about his favorite topic, Eli Manning and the New York Giants. But then the conversation turned to his recovery. And he looked at me and he said, "Dad, someday people will realize I'm not a bad person. I'm a good person. And I have a tough disease." And he looked me in the eye and he said, "Dad, I'm trying my hardest. I promise." Well, today, in the state of Connecticut, you are all granting his promise. You all realize he wasn't a bad person. And it's not about my son anymore. It's about everybody's son or daughter, everybody's sibling, everybody's parent, everybody's friend. We're granting their wish that we are bringing addiction out of the shadows and into our hearts. We are giving them resources they need. And I can't thank everyone in Connecticut who has participated in helping to do this. Everyone here, all the community-based organizations, all the treatment programs, our health insurers, thank you. Thank you.
Thank you, Keri. I'm now pleased to introduce Shatterproof Ambassador Dita Bhargava. She is a longtime friend and supporter of Shatterproof, and as you've heard, she is also a tireless advocate at the state and federal level on behalf of people with substance use disorders and their families and loved ones. Thank you, Dita.
Thank you, and I just want to start by thanking my good friend, Keri. None of this would be happening. I can't imagine the thousands, maybe millions of lives that have been saved or will be saved because of you and because of Shatterproof. And he is such an example of just taking his dedication, leaving everything behind in Brian's memory to get out there and save lives in his memory. And Brian, I'm sure, is looking down proud. Thank you. Thank you to the Department of Mental Health and Addiction Services, DCF. Thank you to Lieutenant Governor, and I have partnered over the last few years and brought many public roundtables across Connecticut to create awareness and erase stigma. Thank you to Senator Anwar. It's been such a pleasure working with you and Senator Rahman with you to make sure that we are passing legislation in the state of Connecticut. And thank you to Rich Kehoe, representing Senator Blumenthal, has also been such a great partner on this issue, and specifically to Shatterproof. I'm Dita Bhargava, and I'm honored to be here today as a Shatterproof ambassador and a proud board member of Liberation Programs. I've also served as a board member for Connecticut Women's Consortium, a member of the Governor's Human Services Policy Transition Committee, an advisory board member for Medscape, and a technical expert panelist for SAMHSA on the issue of treatment centers. I applaud our state's efforts to battle the addiction crisis, and I'm grateful for recent legislation for mental health and substance use disorders. But sadly, despite our best efforts, overdose rates continue to climb as the relentless and insidious disease of addiction spreads. One such victim was our son, Alec Pelletier, who died unwittingly of fentanyl poisoning on his 26th birthday on July 13th, 2018, while living in a sober home in Canaan, Connecticut. Alec was a warm, vivacious AAA hockey player. He was a big guy, really just a teddy bear that anyone who saw him just wanted to give him a big hug. He had these best bear hugs. He was a loving son. He was a protective older brother. He had 3 younger siblings, or 3 kids who miss him dearly. He was a devoted friend, and he helped so many of his friends through their crisis and battle with substance use disorder, mental health diseases. As a teen, Alex suffered from a mild bipolar condition and depression. He started self-medicating, first with alcohol, then with marijuana, then with all too easily available opioids, then heroin. And in the end, Alec wanted nothing more. He had been sober for 3 months, and my husband and I felt like, wow, this is the first time that we felt hope, that he was on the path to recovery. He wanted nothing more than to live a life of recovery, empowered by the love of his friends and his family. During his time of struggle, as parents, we were desperately searching for solutions. I knew we were up against a time frame and a time clock because I was hearing about fentanyl. This was back in 2016 and 17, where fentanyl was just starting to hear about in the news, but the amount of people that were dying every year and that increase was so concerning to me. And I knew that if we did not get Alec on the path of permanent recovery, that the fentanyl would ultimately get to him. Unfortunately, healthcare protocols were severely inadequate, and addiction disease was horribly stigmatized. There was no one to ask, like Gary said, and nowhere we could find solutions. As we trialed and errored several treatment centers over 7 years, over 10, maybe a dozen treatment centers, we were caught in this endless cycle of treatment, recovery, relapse, treatment, recovery, relapse. There was just no solution for our son, and time was ticking away. In 2016, I attended a panel discussion on addiction awareness hosted in my town of Greenwich, and Gary Mendell was speaking. My husband and I heard Gary tell his son Brian's story and immediately knew that Gary would address the issues that were most significantly impacting us, in erase those barriers in helping our son. Gary became a friend and a shoulder we leaned on. He helped my family in times of despair and crisis while we searched for solutions to help Alec. As we continued supporting our son's work toward recovery, I joined Shatterproof as an ambassador to create awareness, erase stigma, and be a spokesperson for addiction disease. In June of 2018, Alec was finally in a good place, and we were relieved. Alec wanted to be on that path to recovery. I remember a very personal conversation with him at my kitchen table that summer. Alec's favorite breakfast was pancakes and eggs, and I'd cooked him pancakes and eggs, and that would get him talking. I was publicly advocating for addiction disease at that time, and I asked Alec if anybody asked me about his disease, how he would want me to speak about it or not speak about it at all. And he answered my question with his own question, which was, would you ask me this question if I had cancer? And that hit me like a ton of bricks because I was stigmatizing. He said, my friends have died of this disease and more will continue to unless we start treating it like a disease and taking action. So yes, get out there and talk about my disease, talk about my story. 3 weeks later, after a 7-year cycle of treatment, recovery, and relapse, Alec passed away on his 26th birthday. He succumbed to his craving because this is a disease, and that's what happens in this disease. It's a rewiring of the brain, and he succumbed to that rewiring craving for one last time. He was at a sober home that was recommended to him by the treatment center he had just been at. It was wrongfully recommended to him. Alec was unaware that his drug was laced with poisonous fentanyl. And he left this world after carefully placing Narcan by his bedside, which no one knew in that home that they needed to help him with. He didn't want to die. The real tragedy, however, is that my family, as we know, is far from alone. Over the last several years, we have senselessly lost thousands of young lives like Alec in our state and over 500,000 people in our country since he passed away. Adolescent deaths have doubled from 2019 to 2021, and fentanyl overdoses are now the leading cause of death for Americans ages 18 to 45, most of it unwittingly. We have an aging demographic, and our young are dying. Our moral, social, and economic obligation is to find solutions to end this crisis. Thousands of individuals like Alec face a drastically altered and hampered recovery process due to insufficient quality control in treatment centers and sober living homes without stable care network to aid those in addiction. And my son was a victim of these inadequate protocols. Research shows that addiction can be treated with the help of certain clinical practices, but the quality of care varies, and it's difficult to tell whether facilities are doing the right things. We watched Alec fail several times because treatment centers were not equipped to help him with his disease, his particular needs, and not delivering what they promised. Atlas is a source of reliable information for people seeking treatment and for their loved ones, as well as for providers, health insurers, other interested in understanding the quality of addiction treatment facilities and improving the quality of addiction care nationally by setting clear and transparent expectations and standards. And the transparency is so important. I wish Alec had Atlas at the time when we were desperately searching for care, but I am so grateful that we have this tool in our state now. And thank you again for Demas for partnering on this. In the past few months alone, I've had several friends who have reached out on behalf of their loved ones asking where to find help, and I can finally channel them to the right source. My family's story is one of thousands, and this should have served as a call to action to team up and support those suffering from substance use disorders. During this National Addiction Treatment Week and year-round, we must make addiction the public health crisis that it is and a priority of epic scale. Thank you again, Shatterproof. Thank you, Demas, Connecticut government, and all of you who are here today supporting this resource for thousands of families across our state. It will help in the crusade to save precious lives in Connecticut and beyond, in Brian's memory, in Alec's memory, and in so many lives that have been lost in all of their memories. Thank you again.
Thank you to Dita and all of our speakers here today. We are very appreciative of the federal government support from Senator Blumenthal's office, from state support from Lieutenant Governor, the Department of Mental Health and Addiction Services, Department of Children and Families, state legislature, from the community, including treatment providers and those who have been impacted directly by this crisis, like Dita and Keri. I think the breadth of support represented here today shows just how widely this disease impacts our communities and the importance of ensuring that people have access to quality substance use disorder treatment. And given Shatterproof's strong ties to Connecticut, launching Treatment Atlas here today is especially special to all of us. We're happy to take questions at this time, and then we will have a training and demo of Treatment Atlas from On God. Any questions?
If I can just add one comment. When we say a training and demo of Atlas, it's gone through multiple rounds of user testing. So I think it's less of a training, it's more of a demo because it's very user friendly. I think anyone going to it the first time without even a demo, I know, because we've tested it multiple times, can get through it very efficiently. But really looking forward for On God to give you a demonstration of it so you can see it live. And I know you're going to just find it extremely intuitive and see how it can help so many people.
Please.
I'm a person in long-term recovery, and I also have a son in early recovery himself. And I work in this field, and I really appreciate this resource because as a parent, also being in recovery, working in this field for so many years, I found it so difficult to find help for my son. And I had always said, I can only imagine a parent without having some of the experiences that I've had, how much more difficult it would be for them. So having this resource where they could begin to find great care for their loved one is so important. And one thing in Connecticut that I've found, it's so difficult once you do have those numbers though to get people to return phone calls, and also continuum of care after someone leaves treatment, the importance of sober living, mental health care, intensive outpatient.
Absolutely. So I can just add a few things, even though that wasn't a question, but thank you. And anything we can do to help, please reach out to us with your son. A couple comments related to that is one related to recovery supports. That's the next vision of Atlas, is to start developing a standard of care for sober homes and build that into Atlas. It's not going to be in the next few years. It'll be subsequent to that, but it could be 3 to 5 years. That's clearly the next part of Atlas, for sure. And actually, I forgot my other comment that I was going to say related to, it'll come up. I'll get back to you. Thank you.
So I wanted to make a couple of comments. First, I wanted to acknowledge Representative Mara, who's here as well. She's also on the Public Health Committee. Thank you. And then I wanted to make sure that people recognize that this issue is a bipartisan issue. You will always get support from everyone because this is a human issue. This is something that impacts everyone of every background. I also wanted to just mention a word about overdose prevention centers. And I think it's worthy whenever we get together to have a conversation on this topic. This works. If you look at Europe has been doing this for 40 years. Canada has been doing this for some 20 years. In Vancouver, for the overdose or safe injection sites, they have, in 20 years, 9 million episodes of use of drug, 9 million observed episode of use of drug, and 0 deaths. And in New York, On Point site, in 1 year, they had 70,000 episode of use of drug and 0 deaths. So people need to survive to have rehabilitation. And then that's why it's important. When I made my comment on the federal law, there are crack house laws which have restricted it. So we wanted to put the overdose prevention center in Connecticut, harm reduction centers, but because of the federal laws, we could not do that. The good news is our legislators are very much on board. Senator Blumenthal is on board. All members of Congress are on board on this issue. I think it's we have to get the word out for the rest of the country to get this law passed, because we need to do whatever it takes to save the lives, meet the people where they are. It's part of the stigma. And so it has many layers of the stigma, Even if we were to pass this, the planning and zoning and local communities would not allow that to happen. And I think the stigma is the biggest disease, which is restricting our ability to take care of our children, friends, family members. Thank you.
And thank you, Senator Anwar, for that point, because it's so important. What I wanted to add is that overdose prevention sites is also a great place to educate, an opportunity to educate people who would otherwise maybe think that there is no other option for them, that this is the way they're going to live for the rest of their lives. And then with Atlas being introduced to the state, for them to right there and then have the opportunity to answer those few questions and find the right treatment for themselves. So it goes hand in hand, but the first thing, like Senator Anwar said, is we need to keep them alive long enough to be able to understand that recovery is real and there are options, real options for them.
If I can add one more point, thank you, Dita, and thank you, Senator. I remember the point I wanted to make. We've been talking about Atlas, one key feature of it, which is helping people today. And we've all talked about how it's going to help people today. We haven't mentioned yet how it's changing the entire treatment system in the United States. Because what it's doing is we're collecting data from treatment programs, from health insurance claims, and information from patients. And we're taking that data and we're giving it into portals, specific password protected website to the state, to treatment programs, and to health insurers. And they're using that data, and they will be as Atlas gets up and running and the data gets better and richer, to improve the treatment system. The state can easily go to our website and see in which counties of the state are there treatment programs providing quality data, and there's counties that there's treatment programs that have less. There's counties where less treatment programs are providing quality data. The state can easily go to their website now and see how are the treatment programs doing against the standard of care, the science-based standard of care, versus the average of all other states. And I can say, wow, in this particular one, we're lower than all the other states. It could be a simple policy change. It could be technical assistance we provide to our providers in that particular one standard of care that they're low on compared to the other states. We're licensing the data to health insurers to use to build better networks. They could see which treatment programs in their networks are not following evidence-based practices and they either have to rise up or leave their network. They could also see which treatment programs that are doing everything right that are not in their network. Reach out and get them into their network. We had one insurance company call us months ago and to be the first to use our information for value-based payment, to pay more for the providers that are following the right standards of care and which ones aren't. We're at the beginning stages of all this. So not only is it helping someone currently for all the reasons we've been mentioning, it's raising the whole net standard of care for the entire treatment system in the United States. It's game-changing. And the last thing I also want to mention is the word prevention has been mentioned a couple times. We've been talking about treatment. And I want to call out Senator Blumenthal. When the CDC in the spring of 2016 was trying to get regulations, or not regulations, but recommendations on the prescribing of opioids, and it was having a tough time issuing those standards because of the lobbying industry out there to reduce the amount of opioids being prescribed. I called Senator Blumenthal on a Sunday and said, I am testifying at a CDC hearing, how can you help? And literally in 2 days, he had a press conference on the steps of Congress talking about this issue, which gave greater weight to my testimony, which the CDC credits us with tipping it over to get those regulations, recommendations, standards of prescribing issue. Senator Blumenthal has been there every step of the way helping Shatterproof, and I just want to recognize that. Because of his help, it could have made the difference of those regulations being issued or not.
I think we have a question here, and then sharing your stories, and thank you for bringing this service to Connecticut.
I too am a person in long-term recovery, and I just want to implore you that connecting and bringing this message to our faith communities and to our synagogues and our churches in the neighborhoods is crucial. I help a lot of women today that look for help through their faith, through their churches and synagogues. So please, when you get to that level and that point, community engagement at the neighborhood level, not just the community level, but getting into the neighborhoods in our area churches, they need this resource and they need to hear about the message of recovery and hope.
Thank you so much for sharing that. And you couldn't be more right that this disease is a complicated one, as you know, and it needs a multi-pronged approach. The community collaboration approach is actually a proven approach in Portugal at the height of their heroin epidemic, and it was one of the worst in the world. By taking that community command approach, they reversed their heroin epidemic by 90% in 7 years. And that's, churches and community organizers and public health officials and legislators all coming together at the grassroots level to provide that. So it is so important. And I know Senator Anwar and Senator Rahman and the legislature is working on how to make sure that we're educating at the grassroots level, but it takes everybody. So I absolutely agree that that's the case.
Yeah, if I can add a comment, we would love your help. So please, right after this, if we can exchange business cards, Anwar, let's make sure we're connected. We're gathering data daily. We're looking at it weekly of how many people are aware of and going to Atlas in each of the 14 states that we're in through different channels. One channel is who's coming through paid search, or how many are coming in through a paid displayed ad, and that's through paid media. And we're also tracking 5 different channels of unpaid, organic. Are they coming through the Shatterproof website? Are they coming through community-based organizations? Are they coming through? We have 6 different channels that we're tracking. We would love to, and we're comparing state to state, seeing how we're doing. We'd love to talk right after this and get your help.
I'm sorry, if I could say one, it's so important for, like I had said earlier, that I had 3 friends reach out to me in just the last few months asking where to find help. They were just as lost as I was 7 years ago. So it is so important to get the word out about Atlas, because if people don't know about it, then they won't, all of this is for nothing, So through community, through whatever channels, whether that's, paid media, earned media, whatever it is, we need to get the word out so that people don't ask me that question anymore. They know exactly where to find the right treatment. And Keri, do you mind just quickly speaking about the lack of standard of care nationally and how Atlas will help make sure that there is a standard of care in these treatment centers? Because we know, because of stigma, that addiction has not been addressed with a standard of care in a lot of those treatment centers. Treatment centers could open up with just a sprinkler system and a certificate of occupancy. This is a disease and it's not been treated as such.
Sure. There's a lot of articles written about, not a lot, but I've seen many articles written about unscrupulous treatment providers. That has not been my experience. My son went to 8 different treatment programs. 1 was closed for improprieties. The other 7 were wonderful people doing the best they could with all their heart. But, to what Dita just said, there has not been a national standard of care for the treatment of addiction. If you have a family member that has heart disease, cancer, diabetes, they'll be treated by someone with a medical degree. There are some a little bit better and a little worse, but they're all in a lane of having been taught in medical school the right standards of how to treat that disease. That's not the case usually in addiction. So when we looked at this back in 2016, I was shocked. No standard of care for the treatment of addiction anywhere.
that was documented. There were websites with government websites. You should be doing these things or that things. So what the first thing we did, which feeds into Atlas, was document one national standard of care. It's 7 principles of care in the 80-20 rule. Let's not have 50 things. Let's narrow, there's not a good business in America that bonuses anybody on 50 things. Let's narrow it down to the less than 10 that have the greatest impact to patient outcomes. And we documented 7, and we pulled every one of them out of the Surgeon General's report in 2000 that came out in November 2016. That was based on 30 years worth of research. And then we added one, which is screening to get into treatment. So if you go to our website, you'll see 8, but there's 3 related to actual treatment. Excuse me, 7. And then we hired Research Triangle Institute. Well, excuse me. First, we hired the National Quality Forum, which is the leading organization in the country related to quality for healthcare. They recruited an expert panel. They took our 7 principles of care related to treatment and developed quality measures of how we can gather data from either patients, from providers, or insurance claims to determine if these 7 were being delivered. Then we hired Research Triangle Institute, the leading nonprofit in the country that does hospital compare and nursing home compare for Medicaid and Medicare. And they developed specific specifications of how to, exact wording of how to gather that data. This is, nothing here is what Gary thinks. Gary's the gatekeeper. If it's got science behind it, proof, shatterproof. It's based on science, Surgeon General's report, one national standard of care, 80-20 rule. The most things, the most important outcomes to patients.
We have another
And that's
question.
all weaved now into that's all weaved into Atlas. So you can go to every treatment program on Atlas and see which ones are following these and which ones aren't.
Well done, Gary. It's John Hamilton from Liberation Programs, and I couldn't be more excited about having Atlas come to Connecticut. I agree with Karen Ablande, and I've been in the field for many years, and I struggle navigating the system for people coming in and calling me all the time and loved ones. And I agree with the standard of care. There are programs, my colleagues around the country, that won't even introduce the life-saving 3 FDA-approved medications for opiate disorder as options for their individuals when they come in or when they leave. But I want to go back to Senator Anwar and Dita's comments about harm reduction. I think you're absolutely right. This is a vehicle to transform the system. And have you considered for the next steps for Atlas, having providers having to indicate whether or not they are harm reduction friendly, adopt and embrace harm reduction principles and philosophy, and don't turn people away with an abstinence only restriction. So if they actually have somebody that's not willing to stop, but they want to have them, keep them alive, can they offer them help? And can that actually be included in the next phase of Atlas?
The answer is absolutely. Great comment, John. Great comment. And absolutely yes. Just like any disease. There's no one going to be turned away from a hospital for heart disease because you're still eating donuts every morning. There's no one that should be turned away from this disease because of following certain harm reduction practices versus complete abstinence. It's a spectrum. And absolutely that's on the short-term improvement of the data we're collecting related to that, no question. In fact, I say short-term next year.
Thank you, Gary.
All right, I want to thank all of our speakers, thank all of you for joining us. We just need a couple of minutes to transition over to our demo of Treatment Atlas, which will be led by Anwar Buttar, Senior Director of State Engagement for Shatterproof. Thank you again.
All right, good morning, everyone. We'll go ahead and start with the Atlas demo. Once again, my name is Angid Buttar, and I'm a Senior Director with the Treatment Atlas team. Thank you again for attending the session today. All right, so for the demo, if everyone can hear me. If you can't, let me know. So the site is treatmentatlas.org. Anyone with an internet connection can navigate to the site. It's also smartphone enabled, so you can get to it on a smartphone or a tablet. So on the site here, as you'll see, There's educational content. There's videos on individuals' user experience. So as Gary mentioned earlier, the site was redesigned and went live in April of this year. And it was done with intention to make sure that individuals didn't feel alone once they're on the site. So we have a lot of storytelling of individuals' experience looking for treatment and being in recovery across the site. So that's a common theme that you'll see. As you scroll down on the main page, you can understand where Atlas is currently available. So excited to see Connecticut filled in on the map as well. And you can see the other 13 states listed here. And as you scroll down to the bottom, again, you can see some additional storytelling as well. What I'll go ahead and do now is scroll up to the top and search for a facility. So I will search for my criteria. I'll just enter Hartford, Connecticut. The location pops up. And so the next screen here, you'll see there's two options that I have. One is I can go straight to look for facilities based on my search criteria, so in this case, Hartford, or I can go to Help Me Choose, which is the assessment that's based on the ASAM criteria that, again, that Gary mentioned earlier. So I'll quickly do that so you can get a look and feel for the assessment. So again, this assessment was created in partnership with ASAM. It's 10 questions. And really the idea here is to get an understanding of the level of care that might be most appropriate given the search criteria. So for the first question, in terms of which of these are causing problems, I'll select heroin or fentanyl. How hard is it to stop using? I'll select can stop but might use again within a week. What withdrawal symptoms would occur if substance use stopped? I'll select mild headache, shakes, nervousness, and trouble sleeping. And again, notice the status bar at the bottom so you can see the progress of the assessment. Next question, any physical needs? So I'll select no, that only need to see a doctor once in a while for checkups. So again, encouragement, right? We don't want individuals to feel like they're stuck here, that they have that encouragement to keep going to complete the assessment. The next question, any problems with mental health? I'll select bothered, but able to take care of things. Next question, any suicidal thoughts or thoughts of self-harm? So first you can see that the 988 number populates there automatically, but I'll select no. Need help with any of these? So you can see some additional items to look at in terms of safe place to stay, getting to and from treatment. But for the purposes of this assessment, I'll select none of these. And the other thing I want to point out at the bottom, if I just wanted to kind of go and get that list of treatment facilities, I could click on see my results so far, and it would send me to that list right away. Any other help needed? So you can see some additional options here as well. If I don't need any help with any of these, I can go ahead and click next. Is there a legal requirement for residential treatment? I'll select no. And then ready to start treatment, I'll select will consider some things but not others. So now you can see the results of the assessment. So the recommendation is for an outpatient program that offers medication for opioid addiction, detox services, and mental health care. And you can also save the results. So if I was thinking of a family member that I want to get an understanding of the best level of care for them, I can save my results and I can send it to maybe that family member's friend or another individual. And again, if you notice, there was no login information, no PHI, no PII, so it's all anonymous also. So for here, once I scroll down now, you can see the recommended treatment sites that populate. So all of my treatment sites that populate now will automatically be filtered based on my assessment results. So no need to start from scratch in terms of looking at the assessment in the filters. There are additional filters on the left-hand side. So substances, treatment services, whether they offer medications, and I can click on the show more filters option here as well. So as you heard Gary mention earlier, special groups, special programs, whether support services are required. On the right-hand column, medications for alcohol or opioid use disorder as well. So I'll go ahead and go back to my search results. And then these are the list of facilities as we talked about that populate. So I'll go ahead and click on Inner Community of Hartford. So all the information that you see listed here was provided to us by the treatment facility. This information, while self-reported, is attested to by either the CEO or senior leader designee at the facility level. Our team also internally validates the information, right? We look at the information, we understand other outliers in the data, we follow up with the providers as needed to validate. So there's a lot of validation that goes into the information that we receive. I won't go through all of it today in the interest of time, but just wanted folks to know that. So this is a facility profile. So first, you see the information in terms of phone number, website. You also see CL reviews, LEBA review. So within Atlas, we have what we call a patient experience survey. This survey is based on the CAHPS and ECHO surveys that are used in healthcare. Those questions have been validated being reliable at obtaining healthcare quality outcomes. Again, a lot of validation goes into that survey process as well. We have algorithms that go behind the scenes to make sure that, for example, one IP address at a certain period of time doesn't leave multiple responses. We have natural language processing to make sure that the feedback is left. There's no profanity or individuals aren't called out by name. And it's a short survey, it's 10 questions, one open-ended text field as well. And also we have validation that goes into place to make sure that responses don't populate to the site until 20 responses are received. And there's two main reasons for that. One is we want to protect patient anonymity, right? We want people to feel comfortable that they can leave the feedback. And secondly, in the password protected portals, we look at that data and it's aggregated to state averages. And so we want a large enough data sample for some of those calculations. Having said that, we're looking at potentially maybe reducing that number from 20, maybe 15. We're doing some of that due diligence as we speak, but the goal is to make sure that that information can go to the site as quickly as possible. So as I scroll down, you can see information at the facility. So how they compare, you can look at the substances and treatment services that they offer. So you can see the checks, right? So it matches the information that I entered via the assessment. You can see ways to pay. So payment options, whether they offer a sliding fee scale, a cost estimate. You can see the insurances they accept. So if you click on this drop down, you can see a list of insurances that the provider accepts as well. And as we scroll down, you can see the principles of care. And this is something you heard from Keri a few minutes ago that really, I think, serves as really one of the foundations of Atlas, really understand from a quality of care perspective, what are the services that are available. And so you see the solid colored boxes on this little donut graph, meaning that all the various services are available at the treatment facility. And if you had questions about more details, so whether it's fast access to treatment or personalized evaluation plan, you can click on see details, and it will bring you down and where you can see some of the additional information listed there as well. I'll scroll back up to the top. And as I mentioned, reviews. So if individuals want to leave a review based on their experience or a family member's experience at the facility, they can certainly do that here as well. And I will bring that up here in just a second, but do want to be cognizant of time. And then again, all the facility details are listed below here. So I'll go ahead and click on leave a review, and our patient experience survey will populate. There we go. And I won't submit the review, but I want everyone to see the questions and the navigation of it. So first question is, tell us who you are. So I'll say I'm a family member or friend of the patient. Question 2, how much have you or the patient been helped by the treatment here? I'll select a lot. So using any number 0 to 10, 0 being the worst, 10 being the best, how would I rate the treatment facility? I'll select a 10. So this is the open-ended text field I was referring to earlier. Not mandatory, but you can leave. You have up to 500 characters to leave feedback about what the treatment facility is doing right and what can be done to improve. So I'll just say staff are fantastic. Click next. Compared to when you or the patient entered this treatment facility, how would you rate your or the patient's ability to deal with daily problems now? I'll select much better. Have staff in this treatment facility talked with you or the patient about including family or friends in counseling or treatment? I'll select yes. We're just over halfway done. When you or the patient needed treatment right away, how often did you or the patient see someone from this treatment facility as soon as you or the patient wanted? I'll select always. During treatment, how often did treatment staff show respect for what you or the patient had to say? I'll select always. During treatment, were you or the patient given information about different kinds of treatment services and facilities that are available? I'll select yes. And then the last page here, how long have you or the patient received treatment at this facility? So you would enter that information, and then you would check the box at the bottom that you affirm that you have read and agree to the terms of service, and you would hit submit. So again, the terms of service being that, for the open-ended text field, that you don't use profanity or call out individuals by name, that you have in fact either received treatment at the facility or you're a family member of someone to that effect. So that's some of the other information that we have listed there as well, or some of the validation within the terms of service that we have. So that is our patient experience survey. So I will back out of here and close that part out. So that is the demo at a high level. Again, I was trying to be cognizant of time. Any questions on anything that I just went over? Yes, Keri. Oh, I'm sorry. Thanks, Keri. Yeah, so the site is translated into Spanish. So all you have to do on this little button on the upper right-hand corner where you see my cursor, you click on that, you click Espanol, it will translate everything into Spanish. I'm sorry, for the assessment, or for the PES here, it's Spanish right here. So that does it into translate into Spanish. We also have collateral that we work with our state partners, our communities, community-based organizations that to help raise awareness of Atlas. And so we have that both in English and Spanish as well, and working in other languages. Yes, Gary. Yeah, sure. Yeah, of course. Well, let me just open up a new tab here. Make it quicker. So on the home page here, as Gary was alluding to, so in the upper right-hand corner, so you see English, click on Espanol, and everything's in Spanish there on the home page. Any questions I can help answer? I know I talk fast, so I apologize, but I hope I didn't go too fast. Yes?
Of somebody if they're looking for help for somebody under 18?
Yeah, great question. So we do have a filter for adolescent programming. So let me go back to English. My Spanish isn't as good as it used to be. So I'll go back to English. I will search again for Hartford. So instead of going through the assessment, I'll just go right to my search results for Hartford. So for the filters here, what I'll go ahead and do now is click on Show More Filters. And so you were asking for age-specific programming. And it's listed here, on the, thank you, I appreciate it. Yeah, so age and gender. So you can see that filter there. I think I'm at the point now where I need reading glasses, and so I apologize. But great question, thank you for bringing that up. Any other questions? It's in the back, yeah?
With the specialized care section, it talks about, child care, food aid, transport, stuff like that. I know like basic needs, housing. Does it offer places that help you connect to community resources?
Yeah, it's a great question. So what we have is in the survey that we send out to providers, if they have programs that help with that, that'll be listed there. So in the search results, you'll see that information. So we may not have that information listed like on Atlas itself, but within the facility profile, if they do, then someone can talk to that provider about, if it's legal help or transportation, et cetera.
Awesome, thank you.
Great question. Any other questions? All right, if nothing else. Anything else in the backside? Did I miss someone? No? Okay. Well, if nothing else, thank you again for the time and for your time to be here as well. I appreciate it. And again, once again, my name is Angad Buttar, and I'm a Senior Director on the Treatment Atlas team at Shatterproof. So thank you so much.
Thank you, Angad, and thank you again, everyone, for joining us today. We're very excited to launch Treatment Atlas in Connecticut. And if you have any questions, want any more information, please don't hesitate to reach out to any of the Shatterproof staff that are here. Thank you again.